Dr. Zweli Mkhize has praised University's hospital in Bloemfontein in the Free State for its preparedness to treat COVID-19 cases. He is in Bloemfontein where a massive coronavirus screening program is underway at Heidedal, a suburb of the Free State capital, following 76 confirmed COVID-19 cases in that province. The tracing of worshippers who last month attended the religious gathering at the Divine Restoration Ministries in Bloemfontein is also continuing. 85-year-old Pastor John Hlangeni from the Global Reconciliation Church died from the virus, while evangelist Angus Buchan as well as ACDP leader Reverend Kenneth Mishwe tested positive after coming into contact with international guests who later tested positive.
Those are your numbers: Eastern Cape 2, Free State 8, Gauteng 18, KwaZulu-Natal 20, Limpopo 2, Mpumalanga 1, Western Cape 27, and then the total is 82. But the ones which are unallocated, so you might find tomorrow the numbers change. They change because we have to ultimately clean this one up. It takes a lot of calls. Takes a lot of phoning around and trying to check, to confirm exactly where they are. Some of the challenges also arise from someone who's in one province, tests, but then lives in another province. So that's why you get this unallocated. It takes us a while. But we use it more for tracing the people. So once we know exactly where the person is, then of course we don't worry too much about this. We correct it. But we have raised the issues with the doctors, with the hospitals, and with the laboratories that they must just make sure we get all the information. But we follow it up after we've given you the announcements.
And as we've indicated, government has started to roll out this mass COVID-19 screening. Health Minister Dr. Zweli Mkhize has visited one of the sites, as you've just seen, in Heidedal in the Free State, with over 44,000 tests, now 47 tests that have been conducted since the first diagnosis last month. South Africa has 1,380 positive cases. Around 67 mobile laboratories have been deployed to help government reach its target of at least 30,000 tests every day. Zamanzima Mazibuko, who is a senior researcher at the Mapungubwe Institute of Strategic Reflection, now joins us via Skype. Good evening and welcome to The Full View. Just a quick one, listening into what the Minister said earlier on. Are you confident that this screening of the mass screening on its own would be able to help us flatten the curve of new infections?
Good evening, and thank you for having me. The mass screening will do some work in terms of flattening the curve. However, when we look at our society and the socio-economic conditions that we're living under, there are many factors that affect how this virus spreads. Including the high levels of poverty, the lack of clean and reliable water. I heard the minister talking about providing water for citizens, but that means that there'll be long queues to get this water. So there needs to be a level of social protection when it comes to implementation of these measures.
And also listening into that press briefing that was just held now, hearing what Minister Patel was even saying about these sanitizers that are being distributed and the quality of these sanitizers, but also going back and emphasizing that washing your hands is the best precautionary measure that you can take. What else do you think it is that the Ministry of Water and Sanitation at least can do to make sure that we don't have those long queues at especially informal settlements and places that don't have running water?
What they can do basically is to provide even more water. We need more water and not just have it in one location. So we need multiple locations so that there aren't long queues. Definitely sanitizers are not, they don't replace water and soap. So we need to make sure that there are multiple stations for water and in the long term, make sure that citizens actually have water in their yards. That is the crucial thing here to actually consider that we need to also be thinking in terms of the long term.
And also the immune system, which is very important, and making sure that these people have the necessary food as well as the necessary nutrition to try and boost their immune system. Even last night, during that press briefing that was also held by the MEC here in Gauteng for Health, stating that people can't be surviving COVID-19 and yet die from starvation.
That is true. And it's also very important, the type of food. Food security is not enough. The food has to be actually nutritious in order for it to be effective. So to just provide people with any sort of food is not enough. We need to make sure that the food is actually nutritious.
Let's quickly speak about what the duties of retailers could be, and also again that press briefing that was held earlier on where the minister is calling on retailers and saying that those who can donate food, please do so.
Yes, indeed. Retailers can play a huge role in terms of providing citizens with nutritious food, but also in the way that they run their businesses. They need to ensure that their shops are not overcrowded. They need to ensure that the employees actually sanitize and make sure that whatever they touch, however they interact with customers in ways that are actually encourage less infections.
Let's quickly then touch on the role of community members themselves. Although there is this call that social distancing should be adhered to, what do you do in the case where you know that you have a neighbor who is struggling?
In that case, well, firstly, we need to get hold of the relevant people. The neighbor themselves cannot be the ones that actually are in contact with the suspected person to be infected by COVID-19. What I know is that community health workers have been tasked with tracing possible COVID-19 patients or their contacts. But what is worrying about this is that there's a shortage of masks, and for them to be in contact with potential COVID-19 patients without the required protective gear is quite dangerous.
Okay then, thank you so much. That was Zamanzima Mazibuko, who's a senior researcher at the Mapungubwe Institute for Strategic Reflection.